Health Secretary Wes Streeting, who joins us now. Good to see you, Mr. Streeting. I know there is real concern, isn't there, about the war on cancer that Sajid Javid... the war on cancer that Sajid Javid unveiled when he was Health Secretary, not meeting its targets. Is there some... do we understand why that is happening?
Well, bluntly, whether it's in cancer care or the wider challenges we have around patient access and NHS waiting times, the NHS simply doesn't have the staff it needs to get patients seen on time, and that's why cancer waits are in an appalling state. And as we know with cancer, as I know from my own experience with kidney cancer, timing really matters. So for 22,000 people to be waiting more than 2 months from being referred to being diagnosed and starting treatment or being given the all clear is completely unacceptable. That's why the government's got to focus both on retaining the great staff we already have in the NHS, but also adopting Labour's plan for the biggest expansion of NHS staff in history. Because if we can double the number of medical school places, increase nursing training places by 10,000 a year, as Labour's proposing, a fully costed and fully funded plan, then we will be able to, over time, build staffing levels back up to where they need to be in order to get patients seen on time.
Strike action recently, recruitment and retention alongside pay are some of the biggest issues. And it does seem, looking at Labour's plan to tackle NHS waiting times, it relies heavily on recruiting more staff. Vast numbers of them, 15,000 more doctors, 10,000 more nurses, 5,000 more health visitors. I mean, where are you going to get these people from, people that are willing to work in the NHS? And as we've seen with the strikes, what appeals to them at the moment with poor pay and understaffing on wards?
Well, we do have an absurd position at the moment where we're turning away thousands of straight-A students from studying medicine every year because the government puts a cap on places and at the same time they're pulling the immigration lever to recruit people from overseas, including from countries on the World Health Organisation's red list. So these are countries with severe health care staff shortages of their own. So we're in this terrible situation where we're doing unethical international recruitment, turning away thousands of straight-A students here at home, and we've got to deal with that situation. You are right, though, Ellie, to mention retention and making sure that the NHS remains an attractive place to work for people who are currently in the health service. I'm really worried about these junior doctors' strikes, and I'm worried that unless people at that stage in their career have great specialist roles to move into once they've finished their junior doctor phase of their career, we're going to lose people to countries like Australia, to Canada, where aggressive recruitment of UK doctors is already underway. So I hope the government can resolve the junior doctors' strikes amicably. I'm very concerned by the breakdown in talks and the mudslinging that government ministers have been doing towards junior doctors. I don't think that's really going to help. Maybe less time on Twitter and more time around the negotiating table, having a serious conversation with junior doctors would help to resolve these strikes.
There's a bigger question here, isn't there, Wes Streeting? What you've outlined here to tackle this particular issue, fair enough. We've got the facts and figures. You claim it's all funded, but it's one issue amidst a failing NHS. Have we reached a point? And I know you've outlined some measures that you'd like to do if you got into power, but are we looking really now at having to properly restructure the NHS to make it suitable, to make it appropriate for the 21st century?
Well, I think the big change that we need in the NHS is to shift the focus of healthcare out of the hospital into the community, better access to primary care. People are struggling to see a GP appointment, get a GP appointment at the moment, which is not only frustrating for patients, it's actually more expensive for taxpayers. An average GP appointment costs roughly £40. To go to A&E, it can be around £360. So it's not only bad for patients that people are struggling to get an appointment, it's worse for the taxpayer. So more healthcare in the community through general practice, community pharmacy, access to specialist community health clinics for specific conditions. I think all of that would help, because if we can do faster diagnosis, we get better treatment and better health outcomes. And finally, this country has enormous strengths in life sciences and technology. Some of the technology that we could be using in the NHS today isn't even particularly revolutionary. Why is it people have to scramble on the phone at 8 a.m. in the morning to get a GP appointment rather than book online or through an app like we do for most of the services we use now? I think getting the basics right is something that the government's gotten badly wrong, and Labour would focus on. And that's before we even get to the really exciting agenda that's out there in terms of the breakthroughs in new drugs, new treatments, and robotic surgery.
But do you accept then that just throwing more money at the NHS, which is often what is called for, isn't necessarily the answer to making it work?
Yeah, I put a really big emphasis on reform for a couple of reasons. One is I'm not convinced that every penny that's going into the NHS today is being well spent. And before I go knocking on the door of the Shadow Chancellor or the Chancellor if we win the general election, I need to make sure that we're spending the money that's already going in as well as possible. And secondly, the Conservatives are leaving the public finances an absolute mess. So we can't just keep on assuming that there will be more money. I mean, Labour's got an ambitious and credible plan to grow our economy, because if the economy had grown under the Conservatives at the same rate it did under the last Labour government, there'd be about £40 billion to invest in public services without having to increase anyone's taxes. So we've got to go for growth. But in the meantime, we've got to make sure that every penny is being well spent, and that's a big focus for me.
Wes Streeting, it's really good to talk to you this morning. Thank you very much indeed. Really
Thanks for having me on. Take care.